PSC നേഴ്സിൻ്റെ പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. കേരള DHS സ്റ്റാഫ് നഴ്സ് ഗ്രേഡ് 2 മെഡിക്കൽ സർജിക്കൽ ക്വസ്റ്റ്യൻസ് 550 മുതൽ 600 വരെയുള്ള ചോദ്യങ്ങൾ പാർട്ട് 13 വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. ഇതിന് മുമ്പുള്ള വീഡിയോകളും കാണുവാൻ ശ്രമിക്കുക, പഠിക്കാൻ ശ്രമിക്കുക. ചോദിക്കാൻ സാധ്യതയുള്ള ചോദ്യങ്ങൾ ഈ വീഡിയോകളിലെല്ലാം ഉൾപ്പെടുത്തിയിരിക്കുന്നു. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ നേരുന്നു. എല്ലാവരെയും ജഗദീശ്വരൻ സഹായിക്കട്ടെ. നമുക്ക് ഇന്നത്തെ വീഡിയോയിലേക്ക് കടക്കാം. Definitive diagnostic method for pulmonary embolism is dash. Pulmonary angiography. Which test reflect the blood glucose level over 2 to 3 months? Glycosylated HP or HbA1c. Immediate assessment of post liver biopsy procedure shows PR 108 per minute. What should be the next intervention? Measure the BP. The nurse understands that a pacemaker is used in some clients to serve the function performed by the SA node. What is the initial management of patient with diabetic ketoacidosis? Intravenous infusion of normal saline. Daily sodium intake for renal patient is dash 6 to 8 gram per day. Decrease in the production of hydrochloric acid in the stomach is known as hypochlorhydria. The chief clinical manifestation that may be expected in the early stage of cataract formation is dash blurred vision. What is the potential complication of thyroidectomy the nurse can assess by asking the client to state name? Laryngeal nerve damage. To encourage adequate nutritional intake for a female client with Alzheimer's disease, the nurse should stay with the client and encourage him to eat. Which metabolic disturbance occurs in hypertrophic pyloric stenosis? Metabolic alkalosis. Orbital apex syndrome involves maxillary division of trigeminal nerve. The enlargement of right ventricle secondary to impairment of pulmonary circulation is dash cor pulmonale. Water deprivation test is used for the diagnosis of diabetes insipidus. Most common cause of arterial aneurysm is dash atherosclerosis. Dissociative anesthesia produced by dash ketamine. The energy level which is used for defibrillation is dash 200 joule. Thyroid related disorders are screened with the marker TSH or thyroid stimulating hormone levels. Causes of nephrogenic diabetes insipidus is dash genetic. Location of pain in angina pectoris is mostly retrosternal. When assessing a client during peritoneal dialysis, the nurse observes that drainage of the dialysate from the peritoneal cavity has ceased before the required amount has drained out. The nurse should assist the client to turn from side to side. Gold standard treatment for Guillain-Barré syndrome. IVIG therapy. Malignant tumor of bone is known as osteogenic sarcoma. Swelling of the optic disc is termed as dash. Papilledema. Earliest symptom of colorectal cancer is dash. Blood in the stools. Ondansetron is the example of dash. Antiemetic. Cracking sore at the corner of the mouth is called dash. Angular cheiliosis. Cholecystography is performed to dash. Diagnose stones in the gallbladder. Shock is characterized by dash. Inadequate blood flow and tissue perfusion. Volume of air that remains in the lung at the end of maximal inspiration is known as residual volume. Identify the correct statement regarding pericarditis pain. Chest pain is almost always present, may be felt in the neck, shoulder, back, or abdomen. Appearance of U wave in ECG suggests hypokalemia. Early sign of cancer of lung is dash. Persistent cough. An autoimmune disease in which an antibody mimics the action of TSH is dash. Graves' disease. Peritoneovenous shunt move fluid from peritoneum to veins. The nerve which is known as musician's nerve. Ulnar nerve. The disease which is characterized by an increase in intraocular pressure and progressive loss of vision is dash. Glaucoma. Correct regarding ligament is dash. It connect bone to bone. Which electrolyte level has to be investigated after thyroidectomy? Calcium. The disease in which clotting mechanism is defected is known as dash. Hemophilia. T wave represents repolarization of dash. Ventricles. In which condition residual volume may be increased? With obstructive lung disease. Deficit factor 8 result in which hemophilia? Hemophilia A. Daily output of urine between 100 to 400 ml is known as dash. Oliguria. Complex partial seizure can be managed with carbamazepine. Ventilator associated pneumonia is defined as pneumonia that occur dash hours or after ET intubation. 48 hours. Biot's respiration is the classical sign of dash. Injury to medulla. Biot's respiration is an abnormal pattern of breathing characterized by groups of regular deep inspirations followed by regular or irregular periods of apnea. It is named by Camille Biot, who characterized it in 1876. Earliest sign in Parkinson's disease. Pill rolling movements of the hand. Guillain-Barré syndrome is a disease of which? Peripheral nerve. Tremor, rigidity, loss of postural reflexes are the manifestations of dash. Tremor, rigidity, loss of postural reflexes are the manifestations of dash. Parkinson's disease. Parkinson's disease.
താങ്ക്സ് ഫോർ വാച്ചിങ്. PSC നേഴ്സിൻ്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. വീഡിയോ കാണുന്നവർ ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. ധാരാളം വീഡിയോസ് PSC നേഴ്സ് എന്ന ഈ ചാനൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോസ് റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. അത് നിങ്ങളുടെ ഓർമ്മയെ കൂടുതൽ ശക്തിപ്പെടുത്തും. നന്നായി പഠിക്കുന്ന എല്ലാവർക്കും ഞങ്ങൾ വിജയാശംസകൾ നേരുന്നു. നന്ദി, നമസ്കാരം.